Well, many children in several communities in 4 regions of the country have been left out of the just-ended national campaign against measles and rubella. That is because nurses and health workers did not have any means of transport to hard-to-reach villages. The Eastern, Volta, Central and the 3 northern regions were affected. JoyNews' Justice Beidou traveled with one nurse to the island community of Eti in the Afram Plains to see how medics access these areas for vaccination.
Moses Ganke is setting out on one of his everyday journeys in a canoe powered by a small outboard motor. He is on his way to deliver vaccines that fight measles and rubella, but the road ahead is a difficult one. There are more than 5,000 people on different islands ahead of him. It's dangerous traveling on the Volta Lake around this time of the year. There are strong winds blowing, making the canoe very unsteady, and the water level is unusually high and cold.
Ghana Health Service is not having an engine boat. We have to get to about 3-4 communities in a day, and we have spent almost 5 hours on the river. Where are you going to get the extra time to reach the people in these island communities?
We have crossed 2 water bodies in the last 1 hour of travel on this river, and I'm told there are about 10 villages still ahead of us. There's a strong wind currently blowing, which makes the boat unsteady, and the water levels are unusually high. These times of the year are some of the most dangerous traveling on this river. But for medics who work in this area, reaching these communities with vaccines could mean the difference between life and death for some children, and so they would have to brave the odds.
The canoe we are traveling in now is a commercial one that moves in and out of the island once a day. And so if you miss it, you have no other means of traveling there.
Thank you.
I've had to pay the boat rider 150 cedis to charter it for this trip. This is the Echi community, a fishing island home to about 1,000 people. This year's rubella and measles vaccine is supposed to be for children between 9 months and 5 years.
Because my baby has been vaccinated, I think she's safe. I am happy. The nurses find it hard coming here. When there are high winds, they can't come, and there's no clinic here.
If the one who is not immunized should have the disease, it can affect the one who has been immunized, because we have other means of transmitting diseases.
This woman is lucky she had her child vaccinated, but many others, not just here, but hundreds of islands in this area, may not get the vaccines, putting them at risk of a killer disease that is otherwise preventable. Justice Beidou, JoyNews, in the Afram Plains.
Well, we're joined in studio by Member of Parliament for Afram Plains South Constituency, Eric Osei Owusu, to have a discussion on the back of what Justice Beidou filed for us. And then we'll also speak to Ajua Asantewa, who is a health worker, who's joining us via phone. Let me say good morning to you, Ajua. Good morning, if you can hear me.
Good morning.
All right. So
good morning, but I am Esther Bamfo, the National President for Community Nurses Association.
Okay.
My household name is Ajua.
Okay, all right. Really appreciate it. Just hang in there for me. Let me say good morning to you.
Good morning.
This is Echi is an area within your constituency, but this is not the only area like that. Can you describe to us how scattered these communities are?
Well, first of all, Afram Plains is a very vast area. We have over 300 or so communities scattered around, the very vast land, which lies in the eastern region, as you know. And a lot of the villages are around the river banks because they're like fisher folks who live there. And so to reach out to them means that you have to travel with these canoes, and there's no other way because most of these areas don't have road access routes. So the only way you can get there is to use the canoes.
And we understand with this story that the Ghana Health Service, for instance, doesn't have a speedboat. So it means that health workers will have to go the way every other person would.
That is true. Like I said, the only way to get to these communities is to travel on the canoes, and it can be very dangerous. We do get a lot of accidents happening there because there are a lot of stumps in the river also. So sometimes the canoes will hit, the river stumps and then capsize, and then you hear that a lot. People losing their lives, which is very sad. I personally have made a lot of calls to government, on how we can. First of all, sensitize the people, to be careful when they travel, and also for government to assist by bringing in speedboats. Because like you've seen yourself, if people are sick and health workers have to get to them, it's a nightmare.
So this is the same means by which people who fall ill have to travel to a health center? I
travel myself on this river all the time.
That's how you campaigned?
Because that's how I reach out to the people who live along the river and on the islands. And so it's a daily thing for me. If I say daily, I don't mean like every single day.
Yeah. But how does it make you feel knowing that there were young children who couldn't be vaccinated? Because this means obviously is not one that you can always rely on.
It's very sad. I mean, this is what we complain about all the time, and it takes government to listen to us and to obviously make a provision for, these children to get the necessary health care, which they so badly need, because we don't have health facilities there also. So some of the things that I'm trying to do is to put up CHIP centers so they can get primary health, care when they're sick. But it's something that, the people there, can't do anything about it, and it just takes government, to really listen to our plight.
Let me engage via phone Esther Bamfo now. Esther, this is your problem that we're putting the spotlight on. Fortunately, in one of the areas in Afram Plains, we've got the Member of Parliament in the studio having a conversation. What do you think? What should change, really?
Thank you very much, and good morning to your lovely listeners. And thank you, JoyNews, for how far you are carrying the whole show. And good morning to a Member of Parliament for that area, too. I think we need a lot of changes. So what he's saying, we have a lot of challenges in respect to health delivery. So the changes we are looking out for is to get access routes to reach out to the areas that are difficult or how to reach areas, so that my people can also deliver quality health service to them efficiently and accessibly. Very also, they need closer facilities to the people, so that per CHIP compound or a facility, my people can stay in there, then offer health delivery to the people. And apart from getting them the facilities, at times the facilities are there, but they are not habitable. The people will have to manage. I'm delivering health service to people, but my own health is at stake. So they should make the place convenient and comfortable, habitable for my people also to live there and work happily for the community.
Okay, Esther, you have to hang in there for me. I know you couldn't reach many areas. We'll come to that. But quickly, let's cross over. Still via phone, let's speak to Dr. George Bonso, who is with the Ghana Health Service. Dr. Bonso, thank you so much for your time. Let's talk about how the just-ended immunization exercise went. Obviously, you couldn't reach the entire country because of some of the challenges that have come up.
Yeah, thank you very much. And so let me first and foremost thank the numerous workers and volunteers who were on the field throughout this to make effort to reach every child with the vaccine. The exercise was set out to reach about 4.7 million children, and you reached close to 97%, which is about 4.6 million. And to me, that's a very good job. This notwithstanding, we're also not happy that we could not reach every child. And the key challenges that actually we faced were in the riverine areas where the heavy rains caused high levels of water, flooding, road blocks, which made some of the areas risky to go. So what really, we did was to ask them to identify those areas. But I must say, as of now, most of the areas have been covered. And the rest have not been covered. As the water level recedes, they will cover every child. So they've done more perhaps to reach out to all those children who are not possible.
So, Dr. Bonsu, you're saying that these areas, for instance, that some of the health workers couldn't cross because they have to go in canoes, because the Ghana Health Service doesn't have those facilities. You're still going to cater for them, or you've catered for them?
Some have been catered for already. Others will be catered for as and when the water level. Because some of them, it's not an issue about the canoe. They are roads which have been cut off. It's not being right through. Some would have the water. At some point, I informed them that they should also weigh their safety also before they venture to those areas. But at least at my last count, most of these areas have been covered. There are still a few areas which they are yet to. But if there's any community which they have not been able to come, I will encourage the community to also quickly get in touch with the local health authorities so that we make arrangements to cover them. But for my information, these are making very great efforts to cover in the German South, which was under curfew. They've just finished covering the German South district after the place was peaceful.
So irrespective of the challenges, you put the figure at, in terms of success rates, at 97.
Yes.
Okay, but what does this mean? It means we still have a small we have a small number. Tell us about the consequences if they don't get the immunization.
Small number left out. And to me, that small number are fellow Ghanaian children, our children. So it's still very important that we reach them. So every district is organizing mop-ups to make sure that wherever those children are located, they are able to get them.
But what's the effect if they don't get it at all?
And our plans to, in the Gratitude, to do massive mop-up for a country to make sure at least we reach out to every child in the country. Just
before you go, Dr. Bonsu, what's the effect if they don't get the immunization at all?
Yeah, the vaccine is going to put the child from getting the disease. But if the child is not vaccinated, a potential risk the child getting the disease in the actually happens around in the community. That is a risk that we stand to. And that's the risk that we want to avoid by ensuring that no child is left out in the vaccination.
Thank you very much.
And beyond the routine vaccination, I also encourage that we send our children for the routine immunization. The campaign may be over, but routine immunization still continues in the country.
Thank you very much for your time, Dr. George Bonsu, who is with the Ghana Health Service. Let's go back to Esther Bamfo. Esther, it's yourself and your colleagues who go on the ground. We're told that there are just about a few places that you haven't been able to reach.
Well, I think what Doctor said, I think, let me say hello to Doctor for the good job he's also doing. That is the places, I think when Justice went, he was able to go to only one place. And I think there were other places in Central Region that they communicated. But I think, yes, it wouldn't be much. But then even if it is one, the chances of other people contracting the disease is also high. So I think what he said, we are looking up to that, so that they resource the committee organizers and the other volunteers, and then they get to the people and then get them.
So which regions have you not been able to reach?
From Central Region, they said in Namibia, there was a village like that they said they couldn't go at all. It's a small community within Chifo, something district there. I think I have the details there. So that is also another district with a facility or a sub-district within a district that they said couldn't go because of the same challenges.
I think the last time we spoke, you mentioned places in the eastern region and in the 3 northern regions. Is this still the same?
Yeah. Yes, the 3 northern regions, Tamale, that is northern region. There is also a village that they said they couldn't go at all. And the name is Kedenge. But half of Pan, there's another village called Pan, but they were able to get half of the people. Parents brought the children Only half were able to come. The other half couldn't come. But the village called Kedenge, they couldn't get there at all. That is the information I had from there. But apart from Afran, there were other, Upper East. They said finally they were able to go, even though their car got stuck and all those things.
Okay, but you still were not able to reach some places in the Afran Plains.
Yes, what justice I also went and saw for.
Okay,
himself, yeah.
So because we have the Member of Parliament for the area in the studio, what do you think? What kind of intervention do you think he can make? He's listening to you.
Oh, what I'm pleading with the MP is also reach out to my people and then ascertain what is happening on the ground. That will inform him as to what to do in respect to health delivery. I think they need facilities. Sometimes they have to cross the river. So can't they also get a facility beyond the river for them to go and stay there than always to high boat or whatever to go? Even if they are there and the rain is so much, the rivers go high, they wouldn't be the need to cross before they get, because they are already there. So I think they should also help put up facilities. Now we are talking about chips compound. We should also help and then get more chips compound around those areas for the people to live there and then work.
Okay.
Even the
chips
compound does not mean only the facility. They should give them accommodation as well.
Okay. Thank you very much. We'll have to leave it here. Let's come back to you, Ms. Eric Osei-Owusu. And I just want to get your response based on what Esther Banfo said directly to you and the kind of intervention you can make.
Well, I think what Madam Esther is saying is true. And that is exactly what I've been trying to do, because you realize that these people, need medical services so bad. And it's rather unfortunate, but even in the whole district, we don't have a hospital. What we have are clinics, and there are no proper doctors. There are nurses who man these clinics. So, I mean, come to think about it, Ghana Health Service in itself is now also helping the people of Afran Plains. Because, I mean, for a whole district not to have even one doctor from Ghana Health Service.
There's absolutely no doctor?
Absolutely no doctor. It's a twin district, Afran Plains South and Afran Plains North. There is a hospital in the north, and they have doctors there, or a doctor there. I'm not sure whether it's one or...
How about the distance between the south and the north?
It can be very far depending on which part of the south you live. I mean, for instance, there are places where you'd have to travel about 2 hours, and the roads are so bad it's unbelievable. I mean, to get to the north where the hospital is. And so if patients are not very well and they have to go on these very, I mean, it's just too bad. I can't even describe it. I wish Joy FM will take it up one day and also cover the roads there. But this is a food basket area. So you would think that at least some attention would have to be given to the place. And these are calls that rampantly I myself as MP have been making them to government. And for some reason, nobody seems
So beyond the calls as Member of Parliament, what else can you do? You have the MP's Common Fund. Can it do anything?
The MP's Common Fund, as you know, is so little, and that's what we use to support little things like chip compounds, which I'm trying to put up. In fact, in the next 2 weeks or so, I'd have to go and distribute cement, because we use communal labor to try and put up these little chip compounds for them. But you see, the other thing is you can't also even get people, health workers, to live there and support them.
There was a proposal by Esther Banfo that build facilities, accommodation facilities for them, so they don't always have to cross.
Yes,
they can live with the people.
That is true. So most of the places where I plan to put chip compounds, I want to attach a one-room quota for the health workers who would want to live there.
Is this something you've started already?
Yeah, it's something I've started already.
Where have you gotten to in terms of building the compound?
I've allocated, as I speak, 2,500 bags of cement, which I'm sharing to 50 communities, and every community will have 50 bags of cement, which they will use for this project. And so, it's just started, and I just hope that by my time, the end of the first term, I would have built...
Before the next election?
Yes, I would have built...
Was this a promise that you made that you must fulfill?
No, I didn't even make that promise, because I really was hoping that, my party is in opposition now. I was really pushing, hoping that my party would win, and I'll push for a district hospital for them. But knowing that things are not the way as it is, as I expected.
You've given up because your party is in opposition?
I haven't given up. I can't give up, because the people need help and I have to be there for them.
But
so
is it impossible?
Really,
is it impossible to get a district hospital because you're in opposition?
Oh, it is possible. It's just a case of lobbying. And I won't want to bring politics into this because we know that at the moment things
lobbying is not politics. Lobbying is a good thing. In fact, I'm sure your constituents
Let me land
voted for you to go to Parliament to lobby.
Let me land on what I was saying. I'm not saying lobbying is not a good thing. That's what we have to be doing. So definitely it's a good thing. But what I'm saying is I don't want to bring politics into it right now because I know the situation as it is. Because neighboring districts, and that is Quo East, for instance, there's a hospital being built there, and then it's ceased ever since the table stand. Not a bag of cement has been taken to the site, and the place is just turning into a forest.
So what's your point?
So the point I want to make is, I'm looking at one which they started, and halfway they've stopped, and they haven't added anything on more. So really, I can't wait and then say that I'm counting on government to come right now. And that is why I've taken the decision to try and do this chip center so that the people will at least have some chip centers there to take care of their primary health need. And that's the point I wanted to make.
Are you thinking about getting a medical doctor also stationed in the district at least?
I can only lobby, you see, because it depends on Ghana Health Service and the way they do their things. But I believe strongly that the place needs a doctor, a qualified doctor who will take care of issues for sick people over there. At the moment, we have nurses there, and the nurses are doing fantastic. They're really helping the people out there, but we need, at least a qualified doctor to be there, to be stationed there, to support, sick people.
Thank you very much for your time. Thanks for coming into the studio. That's Member of Parliament for Afram Plains South constituency, Eric Osei Owusu.